Hi everyone, welcome back. So I'm going to be talking today about PCOS or Polycystic Ovary Syndrome. Now this is something that I see quite a few women with in my treatment room. Probably around 1 in 10 women suffer with polycystic ovaries, which is a common hormonal disorder which basically triggers cysts to form in the ovaries. Now, it can develop in women during teenage and childbearing years, and while probably up to about 50% of cases are asymptomatic, PCOS is the leading cause of infertility in women. There is also an increased risk of complications, things such as diabetes and heart disease in those who have polycystic ovaries. Now, what causes polycystic ovary syndrome? Well, the exact cause, actually, like a lot of these gynecological conditions, is actually unknown. But possible causes that have been suggested include genetics, any kind of disruption to the menstrual cycle due to a hormonal imbalance, which will cause these multiple follicles to start growing. So here you can see the difference in a normal ovary, where there's just a few follicles in there, compared to the polycystic ovary, which has multiple follicles in there, which therefore causes this swelling and causes that ovary to be quite a lot larger than in someone without polycystic ovaries. So basically what happens when you end up with these multiple follicles and an enlarged ovary is that there is not usually, in someone without polycystic ovaries, at the time of ovulation, you would have that one matured follicle which is required for the ovulation process to take place and for the release of that egg. In PCOS, where you have all these multiple follicles, what happens is you have an absence of that one matured follicle that is required for that egg release. And that's therefore why it is a leading cause of infertility in women. So these multiple follicles are highly likely to become cysts, which will then produce male hormones, obviously then causing a further hormonal imbalance. High testosterone, which is that male hormone, and luteinizing hormone levels, and also there will be low follicle stimulating hormone levels. What also happens is there tends to then be a high level of insulin to compensate for insulin resistance, which I'm going to go on to talk about, and this can lead to increased production of those male hormones such as testosterone. Now, in terms of symptoms, symptoms of PCOS usually arise sometimes during the late teens or the early 20s, and the three main features of PCOS are irregular or absent menstruation. So we're talking menstrual cycles that will occur less than 8 times a year, meaning that the ovaries are not regularly releasing eggs, which again, this contributes to the infertility. The second main feature is high levels of that male hormone, testosterone. And often this is why we see in a lot of women with PCOS excessive facial or body hair, acne, or male pattern baldness. And the third feature is these polycystic ovaries. The ovaries become enlarged and swollen and contain numerous fluid-filled sacs or follicles that surround the eggs. meaning that the eggs don't mature. Okay, so you can see here how obviously in a normal ovary the ovulation process would take place with the follicle gradually maturing and then becoming the corpus luteum. But in the case of PCOS, you end up with the development of that follicle stopping, and there are multiple immature follicles, none of which can mature, which then become these cysts that just stay in the ovary and cause it to become swollen. So other symptoms of PCOS, obviously we've mentioned infertility due to the absence of that ovulation. Other symptoms include obesity. Probably around 50% of women with PCOS also are obese. Skin tags, usually on the neck or in the armpits, is quite common. Diabetic tendencies, so there's a high risk of type 2 diabetes and insulin resistance, which I'm going to talk about, which result in high blood sugar levels. And another thing is something called acanthosis nigricans, which is basically where the skin on the nape of the neck, the armpits, the inner thighs, vulva, or even underneath the breasts becomes darkened. Now, there are a few associated medical conditions that also tend to occur alongside PCOS. So these are things like high blood pressure, high blood cholesterol, elevated levels of C-reactive protein, non-alcoholic steatohepatitis, sleep apnea, atherosclerosis, heart attack, type 2 diabetes, and something called metabolic syndrome, which I'm also going to talk about. So quite a few related conditions there. So metabolic syndrome, what is it? Well, according to research, the incidence of metabolic syndrome among women with PCOS is about 11 times higher than for the rest of the population. And it is a combination of at least 3 of the following features, which will increase the likelihood of developing a life-threatening condition. So we're talking things like type 2 diabetes, atherosclerosis, heart attack, heart failure, aneurysm, or stroke. So we're talking at least 3 of these factors. So you've got high fasting blood glucose levels, abdominal obesity, elevated triglyceride levels, low levels of high density lipoproteins, hypertension, and also sometimes if there's a high risk of blood clotting or high levels of that C-reactive protein, it's an indicator of inflammation. So yeah, at least 3 of any of those will usually bring about this metabolic syndrome. So let's talk about insulin resistance. So with insulin resistance, we basically enter this cycle of feeling tired and hungry. We then eat those bad carbohydrates, sort of comfort foods. We then make insulin, the cells resist the insulin, and so the sugar stores as fat, which then promotes this feeling of being tired and hungry, and we end up going round and round in this negative cycle. So insulin resistance is what connects PCOS with metabolic syndrome. The pancreas, as we know, produces insulin, which transports blood glucose into the cells, particularly skeletal muscle and fat cells. Now, receptors in these target cells enable access, and the glucose can then be metabolized and used for energy. When circulating insulin levels are normal or above normal, but those target cells are unable to receive and process that insulin, this is known as insulin resistance. Now, insulin resistance is thought to have a genetic factor, but it can be triggered by eating habits, lack of exercise, which allow those blood sugar levels to rise. So, okay, what is insulin resistance? So, as we just said, in the healthy person, your pancreas produces the insulin, which helps to metabolize the glucose, and the glucose will be stored or used in various organs, metabolized for energy, resulting in a normal level of glucose in the blood. But in someone with insulin resistance, while the pancreas may still be producing the correct amount of insulin, the target cells in the organs become unresponsive to the insulin, and so less glucose is being stored or used for energy, resulting in this increased level of glucose in the blood. So this insulin resistance will result in a few things. Firstly, it will result in hyperinsulinemia, which is where insulin will accumulate in the bloodstream because it's not being used to metabolize the glucose. Secondly, you'll get hyperglycemia, which is where glucose accumulates in the bloodstream because the target cells aren't able to metabolize it. And also it means that cells are going to have to burn other fuel sources in order to make energy, which will generate a lot of metabolic waste. Now, these three things in the long term will certainly encourage the onset of type 2 diabetes and also cardiovascular disease. Hyperinsulinemia can also be a contributing factor in the onset of PCOS. Now, the relationships between hyperinsulinemia and both metabolic syndrome and PCOS are certainly complicated and often circular. The treatment with regards to PCOS. Now, there's no cure for PCOS, but there are some treatment options that may help manage the condition effectively. So this will include things like medication. So this could be birth control pills, diabetes medication if that's an issue, fertility aids, anti-androgen drugs, which will help sort of balance out those high levels of testosterone, and also will treat additional symptoms such as that excessive hair growth or acne, and also irregular periods and possibly even fertility problems. Another treatment that's possible is ovarian surgery. If medication doesn't work, then something called laparoscopic ovarian drilling may be recommended. Now, this is where the androgen producing ovarian tissue is destroyed with heat. So I suppose it's kind of similar to thermal ablation, what that does for someone with endometriosis. Also, lifestyle changes, of course, are always going to be applicable in trying to reduce symptoms. So a 10% body weight reduction if obesity is a problem, combined with exercise and better nutrition, can certainly help to restore ovarian health and possibly, you know, help with fertility issues. Massage, of course, you know, I wouldn't be here if we weren't going to talk about massage. So therapists who treat women of childbearing age are highly likely to encounter clients suffering from PCOS or metabolic syndrome. And while false claims of fixing PCOS should certainly never be made, sharing self-help information can certainly help to improve client outcomes. Massage will usually be appropriate for metabolic syndrome clients who control their condition through diet and exercise. But if there are any symptoms, you know, severe complications associated with it, then the treatment may need to be adjusted to accommodate any circulatory or urinary system weaknesses. And certainly if there is a case of metabolic syndrome, if there are those associated conditions such as atherosclerosis, for example, then, you know, you need to ensure that you are seeing a very experienced therapist who understands these medical issues, because techniques will really need to be adapted, you know, to very specific techniques, you know, to ensure that, for example, bits of plaque that block the arteries in atherosclerosis are not going to break off and, you know, become dislodged and travel off to the lung or something like that. So do make sure that you're seeing someone who is experienced. Now, so what are the benefits of massage for someone with PCOS? Well, obviously, you know, as with any client, massage is always great for, you know, that effect, you know, on increasing the circulation, and certainly in the case of PCOS, increasing the circulation to the reproductive system. Good supply, you know, of blood to the reproductive system is going to help improve functioning, balance out those hormone levels, and also promote a healthy sex drive. Femoral massage is a specific technique involving application of pressure to the femoral artery in order to stimulate blood flow to the uterus and the ovaries. And the result of this is that blood accumulates in the iliac arteries, forcing blood flow into those pelvic organs. And when released after 30 to 45 seconds, the blood should be felt flowing back down the leg. Now, femoral massage is most effective just before ovulation, and it's not something, you don't have to see a therapist to do it. You can actually practice this yourself. And if you haven't seen it already, there is a video on my channel about femoral massage which shows you how to do it, so do take a look at that. It can take a bit of practice, but you know, it's just something else that you can try. So another benefit of massage for clients with PCOS is improved condition of the ovaries. Massage may help to reduce that thick, waxy capsule that forms across the cysts on polycystic ovaries. It may also improve the functioning of the endocrine system, and it does this by stimulating natural endorphin release, and those neurotransmitters such as serotonin, which will help improve the mood and also just decrease the effects of stress, which can really exacerbate symptoms of PCOS. It will also help to reduce those stress hormones such as adrenaline, noradrenaline and cortisol, all of which are associated with this fight or flight response in the body. And the other way that it can improve endocrine function is by balancing out the levels of those sex hormones, which are often quite unstable in someone with PCOS. Obviously, massage, as we know, and we've touched on it there a little bit with the, you know, the the stress hormones. Massage can help reduce those stress hormone levels and therefore reduce the stress, as we've said, that can trigger those PCOS symptoms. And when someone feels more relaxed, less anxious, you know, their pain perception also tends to improve. So that's another bonus. Another benefit is improved immunity levels. Now, inflammatory conditions such as PCOS require a well-functioning immune system in order to be able to heal. And as we've already discussed, in PCOS, there can be high levels of that C-reactive protein, which is an inflammatory marker. During massage, white blood cells, which fight infection, also build up in the bloodstream, hence, you know, helping to improve the functioning of the immune system and just basically allowing the body to heal. Now, there are some precautions, certainly for you massage therapists out there, or if you're going to get a massage, there are some things you should be aware of. Now, there are pituitary, uterus and ovary reflex points on the feet. Now, these may be hypersensitive in PCOS sufferers. So also this is something to be aware of if you're going to have a reflexology treatment. But while they will be hypersensitive, working on these reflex points can also be really beneficial. So it's just a case of communicating with your therapist or with your client, and just going slowly and maybe building up the pressure as can be tolerated by the client. So yeah, communication is really essential. Now, the other thing to be aware of is, you know, if you're doing an abdominal massage, the ovaries in someone with PCOS can be enlarged and vulnerable to bruising. Now, generally in women who aren't pregnant, the ovaries would be located low down in the pelvis, where they're out of reach, you know, during deep abdominal work. But in someone with PCOS, if these ovaries are enlarged due to all those multiple follicles and cysts, you know, the ovary can be located higher up in the, you know, sort of abdomen than usual, meaning that the therapist may have to adapt techniques in order to avoid bruising or keep deep abdominal work to a minimum. Improving the condition of the abdominal muscles and the fascia by working obliquely rather than deeply is recommended. But again, it's a case of communication between client and therapist. So yeah, as I've said, we talked a bit about femoral massage. So if you feel like you might want to try this or find out more, do take a look at my post on here about femoral massage. If you've got any questions or comments, do feel free to comment down below. You can also contact me through my Facebook and Instagram pages. I'm on there as the Medical Massage Lady. If you're a massage therapist and would like to do some training that will give you a bit more knowledge about this area, do take a look at my website, www.medicalmassagelady.com. But yeah, I will answer any queries. Alternatively, you can also subscribe to my channel. You'll be informed of any other videos coming out. Yeah, that's really it from me. So I hope you found the information in this video useful. And hopefully, if you are thinking about having a massage and you have PCOS, it just gives you a few things just to be aware of, maybe things that you need to mention to your therapist as well. But for now, that's really it from me. So I will see you next time.